So when you talk about kind of discovering the importance of omega-3s back in the 70s and Eskimos, we're relatively speaking, this is kind of a new a science, and we're kind of just scratching the surface of really how important these things can be.
Yeah, I absolutely agree. It is a new risk factor. I mean, the idea that it's a risk factor did not surface until we published in 2004 the proposal that the omega-3 index would be considered a risk factor. Cholesterol has been a risk factor for 50 years, and now this has become on the scene pretty new. And so we are just beginning, and partly because it's been in the nutritional world. Omega-3 levels, of course, are a nutritional issue. There hasn't been as much research done on it because if you're dealing with a risk factor like cholesterol, that the best way to lower it is to take a drug. There is a financial incentive for the pharmaceutical industry to develop drugs, and they spend billions of dollars studying these, doing big trials, giving people the drug or a placebo and looking at the effect. And so we have huge amount of data about statins and their benefit for heart health. If statin was a nutrient, we wouldn't have any of that because there would have been no financial incentive to doing it. You can't patent omega-3s. And so that's held this up quite a bit. But I think the momentum is growing. We have a snowball coming on here, which you and I can relate to. This is growing, and as the evidence continues to mount, there are now pharmaceutical companies making and selling omega-3 as a drug. And you can only get it by prescription. It's a very high constant. There's only one in America right now, one product, but there are a couple of others in development. But that one product that is prescription omega-3 in America is $1 billion drug this year, which is a phenomenal thing. And the fact that there's that much money in omega-3s as a pharmaceutical is what's attracting other companies into it. And this is going to build our evidence base tremendously because these people have a financial interest in showing that their product does X to some disease. So there's a lot of fun things going to happen with omega-3 in the next decade.